When it comes to affairs of the heart, you say, who is concerned about that? Well, anyone with a heart. Some are born with congenital heart defects. We're also seeing young people, healthy athletes go down after a cardiac arrest. And of course, most of us are familiar with the #1 killer of men and women around the world, heart attacks from heart disease. At Modern Heart and Vascular Institute, they can pretty much predict an event is on the way. Early detection gives you a chance to fix things and save you from a lot of heartache. Joining us with things to look out for and why that's even more important since COVID is Dr. Mayank Agarwal with Modern Heart and Vascular Institute. Good morning.
Good morning.
All right, you have a familiar last name. A lot of people know we've had Rajiv Agarwal on the show before. There's a relation.
Yeah, he's my uncle.
Yeah. Was he the inspiration for you to go into cardiology?
A little bit.
Yeah. All right. General cardiologist, you serve in the Tomball, Humble, and Woodlands location areas, and your special interest is in coronary artery disease, sports cardiology, cardiac imaging, heart failure, preventative cardiology, and quality improvement, which points to there's a lot that goes into the heart. Modern Heart, y'all treat just about every age.
Oh, that's correct. Yeah, we see anyone from newborn to last week I saw a 95-year-old. So we have a wide variety from birth to, towards the end.
Yeah, and people, of course, who have the specialties that we're talking about. When it comes to congenital heart disease, that means that someone may be born with the heart defect.
Correct. So congenital heart disease is something that someone is born with, but as an adult that treats our patients, we can see some of this stuff in our adult population as well, because a lot of times, these manifestations of congenital heart disease doesn't pop up into our 30s and 40s, and a lot of times we see these individuals later on in their life when they've had these defects that happened in utero.
Yeah, sports-related heart issues. This is crazy because when the heart sometimes is not under duress, some of these things won't pop up, but when it's under duress, they do. We've seen cardiac arrest in seemingly young, healthy athletes.
That's completely true, and with recently Bronny James having an arrest, we saw on Monday Night Football we had Damar Hamlin going down. So it's becoming a lot more prevalent now, and I think it's very important that even though these are our fittest people, and when I talk about athletes, I also include our police officers, our firefighters, our high occupation pilots who have a job that's as stressful and as important as our athletes. And when they get put into these vigorous training, vigorous modalities, they are at risk. So it's always important to get screened to make sure that everything will be okay when you're going through these high level intensity training.
One of the reasons why we have defibrillators on site so many different places. But let me clarify, a cardiac arrest is not the same as a heart attack, though, right?
Correct. So heart attack, what that means is you have abnormal blood flow because you have a blockage in the heart and to our coronary arteries, which are the arteries that supply blood to the heart. Whereas a cardiac arrest is your heart just stops pumping. And you can have a cardiac arrest for, usually it's an electrical cause, and heart attack is more of a circulation cause. And what I tell people is, there's a big difference, and it's important to know the difference between those two because the management can be a little different.
Yeah. All right. Ever since COVID, we started to see some other issues with the heart. What are those issues?
Right. So COVID, it was a viral infection, and what we're starting to see, even up to now, 4 or 5 years out, is we're seeing inflammation of the heart from long-standing COVID, which is called like myocarditis, and it's a big thing still in our population that we're still seeing with COVID patients.
Yeah. All right. Heart disease, heart attack, still the #1 killer, as I mentioned earlier, of men and women around the world. And it's interesting because people still have these myths that, it's mostly a men's disease. It is not. It's about 50-50, right?
Yes.
And then people think, well, I'll know a heart attack is coming, won't I? You can do imaging. And then that imaging is really interesting. I did that imaging, and it was so good to do that because I know that I don't have any heart issues that you can see, so that's good. But for so many people, it catches them by surprise because they don't have symptoms.
Right. And, I always say, if you're seeing a cardiologist when you have symptoms, you're a little bit late in the game. We do a lot at Modern about prevention. And one of those things that we can prevent is, based off your history and stuff, is doing a heart scan. And we're able to see if you have any blockages or any calcium buildup in your arteries. You're also able to see if the origin and the structure and the course of your arteries are normal. So a lot of things we can do before you actually have an event.
And this is like seeing is believing, because I know a lot of times people say, oh no, I did the stress test, we had an EKG, or we had this, or we had that, but that's still not actually seeing what's happening inside the heart.
Correct.
And there are so many things to do today that can, in terms of not having to crack the chest anymore. I know my dad, when he was 80, had a heart attack, quadruple bypass, they cracked his chest, but fast forward 14 years later, and my mother had the TAVR procedure for congestive heart failure, and they just went up through the groin, and she talked to them throughout the entire thing. What are you doing there, right? But so congestive heart failure is another thing that we see generally later in life.
Right. So congestive heart failure, there's two types to kind of simplify it. One is, and a lot of times we focus on it more, is impairment in the contractility. So when our heart weakens in general, our heart function goes down, causing congestive heart failure. But as important, or even more important, is the relaxation of the heart. And age is a big risk factor. If you have high blood pressure, all that leads to the relaxation.
Diabetes, all the types
Correct.
Of things,
the relaxation going down, and that also can cause issues with congestive heart failure, having leg swelling, shortness of breath, and treating them is very important too.
Yeah, you mentioned leg swelling. You all also treat veins, and sometimes
Correct.
people forget that cardiac issues and veins it's all related, right?
Right. So we're, I like to say we're a whole circulatory system. So veins, arteries in the legs, dealing with, like your mom had the TAVR procedure, heart valve. So pretty comprehensive in terms of our evaluation and making sure we get everything in the circulatory system.
Yeah, and if you have vein disease, again, just like I mentioned, how technology has changed with heart procedures, has also changed with veins. They used to do vein stripping back in the day. Don't have to do that today. You have procedures. I have a friend I just took there recently. You get in, you get out, and your downtime is really kind of non-existent. All right, when should you see a cardiologist? We mentioned that if you're having symptoms, you're pretty much late in the game. However, I don't want to go past letting people know what types of symptoms to really get your attention.
Right. So symptoms-wise, chest pain, shortness of breath, if you're feeling like you're passing out, or dizzy spells. Those are, telltale signs of, definitely needing to see a cardiologist. But I always say, you want to see a cardiologist before all this happened.
Right.
We're an open door. We're friendly people. We want to be able to see you when you're not having these symptoms, so we can kind of work you up and make sure you won't have these symptoms, or we can prolong all this. So there's different modalities we can do for that. And if you're coming in to see a cardiologist when you're having symptoms, you might be a little bit later in the game.
At the very least, when you get in there, I guess the heart's like any other organ; it requires
Correct.
maintenance. See at least where you stand.
Yes.
Well, thank you very much, Dr. Agarwal.
Thank you.
Again, Modern Heart and Vascular Institute can see patients of all ages. They have several locations throughout the greater Houston area. To book an appointment with a board-certified cardiologist, visit them online at modernheartandvascular.com or give them a call at 832-644-8930. Again, that's 832-644-8930.